The topic under discussion today is about the gout. Now this topic is going to be discussed in a very simple and easy way. How? Like very simple. First of all, I'll tell you people what is gout in a very simple and easy way. Then I will talk about the cause, the main cause. After that I will talk about some other causes. And then I will talk about how this is actually caused, means the pathophysiology of the gout. Then at the end we'll discuss with you guys the pharmacology, means the drugs that are used to treat gout. So let's get started from the very first point, that is gout. What is gout in simple words? Gout is actually the disease of joints. Very simple. Now what is happening in this situation, that our joints start feeling like burning, means burning sensations are seen. One. Number two, inflammation. Number three, pain, and sometimes redness may also be seen. Now these are the major signs and symptoms regarding the gout. Now let's know the very first cause of the gout. The very first and prominent cause is the high purines intake, means when we take purines in excess, that will cause what? The gout. Now what are the purines? You know what purines, like adenine and guanine, these are the purines. When we take these two in excess, they will cause gout. Now from where we take these purines? Very simple. When we consume alcohol, when we take red meat, fish, beans, and etc. Now these all are the very products from which we take purines. If we use these in excess, they will actually cause the excess of the purines in the human body, in our body. Then that will actually cause gout. This is the very first cause. Number two, number three, number four, some other causes, like when a person is having kidney failure, means there is a problem in the kidneys, that may also lead to gout. And sometimes diabetic patient and obesity may also be responsible factors for the gout. Now let's know the pathophys, how this gout is actually caused or seen. First of all, when we increase the purines intake, purines rich diet, when we are consuming the purines rich diet like alcohol, meat, red meat, fish, beans, etc., these purines will be absorbed and will be targeted towards the liver, means they will move towards liver. Then in the liver, these purines will be converted into uric acid. First of all, purines will be converted into hypoxanthine, then to xanthine, then to uric acid. Now here in this part, a very important enzyme that is doing a very important job, means which is converting purines into uric acid, that enzyme is known as xanthine oxidase. This is responsible enzyme for the production of the uric acid. Now when this uric acid is produced, synthesized, this will be eliminated from the body, means this will be moved out through urine. But sometimes when this is in excess, means when there is excess of the uric acid in the body, now this uric acid, when it is moving through the nephron and it is becoming a part of urine, in the meanwhile this excess uric acid, part of it will start moving in the urine and the part of it will be reabsorbed, will start moving back into the blood through the urate transporters, urate transporters. Now this uric acid which is moving back to the blood, now in the blood that will start moving and they will reach joints. Now here is the reach joints. Now in the joints we have synovial fluids. Okay, synovial fluid. Now this fluid has got a very important function. It will start dissolving this uric acid. Now what happens when this is in excess, when excess of the uric acid is coming to the joints, now this joints fluid, that is synovial fluid, that will become saturate, means then no more uric acid will be dissolved. So that this uric acid will start accumulating. Now as this uric acid starts accumulating, in the meanwhile the phagocytes will approach these uric acids. Now phagocytes are actually helping to reduce this uric acid from the synovial fluid. What happens in the meanwhile? Very simple. This phagocytes will release its chemical content, which is actually acidic. Now that acidic content will interact with the basic content of the uric acid. Now these both, when they will interact, after their interaction, further there will be the production of unionized uric acid crystals. We call it as urate crystals. Now like this, what is happening? Uric acid is coming in excess, and again here by means of these phagocytes, further there is a more synthesis of the uric acids, means uric acid synthesis is increased. Now this increased in the uric acid concentration will cause the precipitation. Now here the uric acid will precipitate. After that there will be the sign and symptoms seen, like burning sensation in the joints, inflammation and pain in the joints will be seen. So this is how actually the gout is appearing. Okay, now this was the pathophys. Now let's come towards the pharmacology. Here we'll talk about the drugs used to treat gout. Just concentrate in the gout. We were having pain, inflammation, and increased concentration of the uric acid. So now these are three of the very prominent sites on which we will work. Means we will take the drugs to work on these sites. We will alleviate the pain, inflammation, and then we will try to decrease the uric acid concentration in the body. How? Like very simple. First of all, in order to alleviate the pain and inflammation, we will take NSAIDs. Okay, NSAIDs like indomethacin, naproxen, and colchicine. Now these indomethacin and naproxen, they are important and responsible to alleviate the pain and inflammation. And we know about the mechanism of action of the NSAIDs, how they are actually alleviating the pain and inflammation. If you don't know, please visit our lecture on the NSAIDs. Now let's come towards the next one, colchicine. This is having property like a anti-inflammatory. Along with that, it has got important job. That is the inhibition of the phagocytes. It will inhibit the phagocytes to interact with these already available uric acids. So now what will happen if they're not interacting? Means like this, we will have a kind of decrease in the synthesis of the uric acid. So this is how we are decreasing the uric acid from here. Now next is the urate crystals. When they are synthesized, we will have some other drugs which will help in decreasing these urate crystals, like uric acid inhibitors, and some drugs which are going to help us to excrete this uric acid. Now uric acid inhibitors, these like allopurinol and febuxostate, now these are actually called as hypouremic because they are responsible to decrease uric acid concentration in the blood. So now how they are going to decrease? Allopurinol and febuxostate, their site of action is actually this enzyme, xanthine oxidase. When these drugs are indicated, they will actually inhibit this enzyme. If this enzyme is inhibited, what will happen then? Then the purines won't be converted into uric acid. Means there won't be the uric acid synthesis anymore. Okay, so like this we decrease the synthesis. And here we have some drugs which are going to help us excrete this uric acid, which is actually not available in the body, like probenecid and sulfonylurea. Now these are the drugs which are going to help excrete the uric acid from the body. How? Like very simple. Their site of action is actually the urate transporter that is available in the nephron. So now this, if we use these drugs, they will compete uric acid. Guess what? Here uric acid is coming, and along that there is probenecid. Now these probenecid and uric acid, they will compete on this transporter, uric acid transporter. What will happen? Now this transporter will be blocked by the probenecid because probenecid has more potential to attach with this particular transporter than the uric acid. What will happen then? Very simple. Now this uric acid will start moving in the urine. This will become a part of urine. So this they will become the part of urine and will be excreted out from the body. So at the end, what we got? Very simple. By means of these drugs, we alleviated the pain, inflammation, and we decreased the synthesis of the uric acid. Along with that, the concentration that was already available in the body, we removed that very concentration from the body. So like this, when the uric acid concentration decreases in the body, then the patient will feel better. That's it. All from my side.